who has arrived. Thank you very much. Dr. Angela Mazza is with us now. She's triple board certified in endocrinology, diabetes, and metabolism, internal medicine, and anti-aging and regenerative medicine. So welcome, Dr. Mazza.
Oh, thank you so much. I'm trying to just get my slides up. Oops.
I so appreciate all of you on a Saturday.
Oh, thank you. Um, Sherry, can you just help me share my screen?
It should be shareable because I gave it to everybody. At the bottom of the screen where you're seeing share,
Ah, okay. Sorry.
that's okay.
Oh,
You should be able to, and then find your screen and then put it on full and yeah,
ta-da.
something's working. There you go.
All right, cool. Thank you. I'm not that tech savvy, Sherry.
You got it. You did wonderful.
Well, thank you so much for having me today. I guess I'm at the tail end of the summit. I'm guessing, which is good, and I understand everything's been going really, really well.
We saved the
Uh,
best for last. Think of
oh
it that way.
goodness. Well, thank you. Well, I am just so pleased to be here. I'm bringing the endocrinology kind of lens to this whole conversation. So I want to thank you, Sherry. I want to thank the Global Alliance for inviting me, and I want to thank everyone for kind of tuning in on a Saturday. As Sherry said, I am an integrative endocrinologist, and sometimes people don't really know what that means. So, endocrinologist is anyone who studies hormones, and integrative is I combine traditional medicine along with more functional. So, functional medicine is a more proactive, root cause based type of approach, and whereas sometimes traditional can be more reactive. So, we combine the best of both worlds. So, this was such a pleasure to kind of talk about the role of hormones in male breast cancer. And let's just kind of get rolling. So the objectives of my presentation today. So first we're going to be diving into how hormones influence male breast tissue. And I'm going to try not to reiterate too much what you might have already heard, but it'll be from a different kind of endocrinology scope. Uh, because hormones influence male breast tissue, because we tend to think, yeah, hormones are important for women, especially women in breast cancer, but it's super important for men as well because we all have the same hormones. We just have them in different ratios. Next, we're going to dive into the hormonal drivers that go into male breast cancer, like estrogen, testosterone. Aromatase is an enzyme that's super important in this discussion, and prolactin. We'll look at what actually causes hormonal imbalance, things like obesity, liver disease, environmental exposures, and how these players can increase risk. We'll review hormonal receptor status. I know Dr. Park was just talking about receptors, but we'll look at it from a hormone standpoint. And then we'll just touch base on some of the current therapies that do address hormones. All right. So as everybody's tuning in knows, male breast cancer is rare, but it's very, very real. Um, and you know, it can be scary because we don't talk about it a lot, but the more we have uh, ways of looking at it, like this Global Alliance Summit, it sheds light on a topic that can be a little less scary. So when we know more, knowledge is power. And hormones are super important chemical messengers that are sending messages to every single part of our body all times of the day. We don't even know what's happening most of the time. We wouldn't want to know because it would be alarming, but we want to keep things in balance. Hormones are constantly trying to keep things in balance. And when it comes to hormones, they play a major role in breast tissue growth, especially and including male breast tissue. So we need to understand these hormonal factors so that we can make better choices for prevention, and that's key to integrative medicine, treatment, as well as long-term health, because empowerment is key. So male breast cancer happens when abnormal cells grow in that small amount of breast tissues that men naturally have. So even though men don't have a lot of breast tissue, they still have ducts and glands, and these can become cancerous, same way as women. And as we know, it's rare, only about 1% of breast cancers occur in men, but because it's unexpected, it's often found later. So that's why awareness is so important. So the main risk factors, as we probably reviewed, include getting older, having a family history of breast cancer, or a BRCA gene mutation, hormonal imbalances like higher estrogen or lower testosterone levels. So while male breast cancer is rare, it's very real, but it's very detectable and when caught early, very treatable. So let's kind of dig into hormones. So I think about hormones pretty much almost all the time during the day because I take care of persons with hormone issues, whether it's estrogen imbalance and testosterone imbalances, thyroid, insulin resistance falls into that. But let's kind of take a step back and talk about why hormones matter in this male breast cancer. So these hormones, they're working all the time. And when they're out of balance, that's the issue. So in men and women alike, they regulate everything. They affect our energy, they affect our mood, they affect our growth, they affect our metabolism. But when it comes to breast tissue, hormones also influence how cells grow, how these cells divide, repair, and then that's where the issues can come into play. So the key players here are estrogen, testosterone, aromatase, and prolactin. So estrogen, although it's a very important hormone, it can encourage breast cell growth, and this can happen at an abnormal rate. So men normally only have a small amount, but when estrogen levels rise, and we'll talk about obesity, liver dysfunction, some meds, it can stimulate breast tissue at the same time that can lead to abnormal growth. Now, testosterone, on the other hand, we always think of it as terms of a male hormone, which it is, but women also make testosterone. Women actually make it at higher ratio than men, but testosterone is a primary male hormone, so it helps keep estrogen in check. So, but as men age, we sometimes call it andropause, they can have a decline in testosterone. But there are other conditions that can influence testosterone levels too, that can cause them to fall. But when that happens, we see a tipping point between testosterone and estrogen. And although estrogen is a really wonderful hormone, it has all sorts of great benefits, which we'll discuss, it can be an inflammatory hormone. Now, aromatase is the enzyme that's found a lot in fat tissue that converts testosterone to estrogen. So that means, when we have a little bit more fat stores, we convert more testosterone to estrogen. And that further kind of shifts that hormonal imbalance. Now, prolactin we'll talk about, it kind of comes at it from a different angle because it comes from the pituitary. Prolactin actually stimulates milk production in women. But we have it in men have it as well. Again, we have all the same hormones, it's just different ratios. But when prolactin is high, it has the potential to support breast cell growth and abnormal growth. But the key thing is, while all these hormones are important, when they're imbalanced, whether it's too much estrogen, not enough testosterone, too much aromatase activity, breast tissue can respond by abnormal growth. So over time, the hormonal environment really influences the development, especially in male breast cancer. Now, not to overwhelm anyone with a pathway, as an endocrinologist, I think in pathways all the time, but just to kind of set the stage for hormones, we call this the steroidogenic pathway. This is how we make our steroids. So steroids aren't necessarily steroids that we take for inflammation like prednisone or anything like that, but steroids actually, endogenous steroids include our cortisol. So cortisol is our most important hormone, and we'll talk about that. But steroids also include testosterone. They also include progesterone. They also include estrogen. DHEA is a precursor hormone to testosterone. But everything when it comes to the steroid pathway actually starts with cholesterol. So if we don't have cholesterol, we can't make any of the hormones in this pathway. Now, everything is determined how much is made based upon what the body's needs are at the time. So whatever the driving need is, whether we'll talk about stress, if it's cortisol, we kind of push all these substrates toward cortisol. But even though this looks really black and white and two-dimensional, this is actually very three-dimensional. Thinking about it, there's enzyme reactions going on all the time, and determining what our body's needs are, there's an uptick or downtick in any of these hormones. So let's start talking about estrogen in men in particular. So again, estrogen we often think of as a female hormone, but in reality, men also have and need estrogen. So estrogen is made by that enzyme aromatase, and that converts testosterone into estrogen. So that's where most men get their estrogen from. And this generally happens in the fat tissue. It can happen in the liver, and it can even happen in the brain. So in a healthy environment, estrogen plays a number of roles for men. So it supports bone strength. It helps maintain brain and cardiovascular health. It contributes to sexual function. So we think of, okay, testosterone is the main driver of sexual function in men, but actually estrogen plays a part as well. So we actually need, everybody needs some estrogen to stay healthy. And this has become the debate as far as hormone replacement across the board in men and women. The pendulum is swinging, we need hormones. But the problem is when estrogen levels become too high, so that balance between estrogen and testosterone shifts. So what could cause this? Well, obesity. So when we have more fat tissue, we have more of that enzyme called aromatase. So more testosterone is going to be converted to estrogen. Now, liver disease, we can also see this scenario. So estrogen is actually, we don't think about detoxifying from hormones, but we actually do detoxify, specifically estrogen. So estrogen goes through a number of detoxification, not to get into technical at the level of the liver, but we're not able to clear estrogen because of liver disease, whether it's fatty liver, whether it's alcohol, whether it's medications, estrogen kind of hangs around in the system and we're not clearing it. There's certain medications and environmental exposures, which we'll talk about, that can act like estrogen in the body. And then when testosterone actually just naturally declines, we see that discordance between testosterone and estrogen. But it's when estrogen levels are too high, we see stimulation of breast tissue growth. We'll talk about gynecomastia because that's that benign tissue growth that we can sometimes see with too much testosterone. And when we look at the research, men with higher blood estrogen levels have a significantly increased risk of developing male breast cancer compared to those with lower levels. And it's almost like estrogen is fuel on the fire, especially if there's estrogen receptor positive tumors. So I don't want to set the stage that estrogen is scary. It's not the enemy. It's really the imbalance that matters. So keeping hormones in balance, whether it's healthy weight, healthy liver function, lifestyle choices are so essential. We talk about it in so many different chronic conditions, but this is one as well. So let's kind of turn our attention to testosterone. So testosterone, again, the hormone we most associate with men's health, it's produced mainly in the testicles, responsible for male characteristics like muscle mass, energy, mood, libido, but it actually also plays a key playing role in breast tissue. So under normal conditions, testosterone acts as a protective hormone for men when it comes to this scenario. So it helps counterbalance those effects of estrogen. Testosterone keeps the growth that may be affected by estrogen in check and limits estrogen's influence on the breast cells. But the issue is when testosterone drops low or too low, that balance is lost. And when it comes to hormones, it's all about balance. So when we lose balance, there's inflammation. This can happen naturally with aging, obesity, chronic illness, medications, testicular problems. But the lower testosterone means that estrogen has kind of a stronger relative effect. The estrogen levels might not even actually be that high. It's just that the testosterone is too low to balance the estrogen. And we know through research that when testosterone is low, estrogen signaling increases. So that in turn stimulates that's signaling that estrogen can play in this case. What's interesting though, studies show that androgens, including testosterone and dihydrotestosterone or DHT, DHT is a kind of a metabolite of testosterone. They actually may inhibit breast cancer growth in some situations. So certain male breast cancers can even express androgen receptors or AR receptors. And when these AR receptors are activated by testosterone, they can actually suppress the growth that signals some estrogen triggers. So There's more to come on that. So the takeaway is maintaining a healthy testosterone level might not only help us feel better, they can help with mood and metabolic health. We have countless studies that show now that testosterone is important for just overall metabolic health in general, but can actually protect against breast tissue changes that can go along with developing breast cancer. So I don't want to say that more testosterone is always better. That is not the case, but because too much excess testosterone can be converted to estrogen, especially in fat tissue. But again, the key thing is balance. As far as the aromatase enzyme, we've kind of touched on, it's that converting enzyme from testosterone to estrogen. So aromatase is kind of the key enzyme in this hormone story. So it's like a little chemical converter in the body, and its main job is to transform testosterone into estrogen. This happens in both men and women, and it really helps to regulate hormonal balance. If you kind of think back to that pathway, that's the enzyme that converts testosterone into estrogen. However, and I'd like to add that actually aromatase is found mainly in the fat tissue, but actually can be found in liver and muscle. But whenever you have more fat cells, you got more machinery to make more estrogen. And normally this helps maintain the small amounts of estrogen that we need, but too much is not a good thing. So when a guy's carrying around excess fat, especially in the visceral area, aromatase activity can increase. And the more fat tissue there is, the more aromatase enzymes are available, the more the testosterone is going to get converted into estrogen. This in turn leads to higher circulating estrogen levels. So that ratio between testosterone and estrogen is off. And that enzyme's just doing what it's meant to do in that scenario. So it's worth noting that aromatase activity can rise in a number of conditions like liver disease. So not only having liver disease can prevent you from clearing estrogen, but it can also increase aromatase activity. So it's a double whammy when it comes to hormone imbalance. So really, aromatase really is that connecting enzyme between metabolism, body composition, and hormone health. And it's really one of the major bridges between obesity and male breast cancer. Now, prolactin. So prolactin is a kind of an interesting hormone. It comes directly from the pituitary gland. So the pituitary is we used to call it our master gland. It sits between the lobes of the brain. We now know that the pituitary is not the master gland. The brain is actually the master gland, but the pituitary makes a number of releasing hormones. Specifically in the anterior pituitary, we see releasing hormones that influence thyroid release, influence testosterone release, cortisol release, estrogen release, growth hormone. But prolactin comes directly from the pituitary. And its real main job that we always think about is helping women produce milk after childbirth. But again, men make it as well. In both men and women, prolactin really affects more than just the breast. It does play a role in reproductive function in both men and women, plays a role in immune modulation in both men and women, and even metabolism in both men and women. And under normal conditions, men only have a small amount in their circulation. This is a hormone that's under constant inhibition, whereas most hormones are under stimulation to be released. So some studies have reported that elevated prolactin levels in men with breast cancer have increased so too much prolactin can cause and influence breast cancer. Prolactin may also make breast cells more sensitive to estrogen. So that further enhances those growth signals that estrogen is sending to these cells. So if you put it this way, if you already have the setting where there's too much estrogen, too much aromatase converting testosterone to estrogen, and then put on top of it elevations in prolactin, which can be caused by a different number of different things, it's kind of like it's the perfect storm for breast cancer. So the research is still evolving on this. We don't know whether prolactin directly causes cancer or higher levels simply reflect other changes like stress, Pituitary tumors can cause too much prolactin. Dopamine changes can cause too much prolactin, liver disease, as well as metabolic imbalances. So a lot of the same players and scenarios tend to cause influences on these hormones that all kind of result in the same thing at times. So the takeaway is when we talk about prolactin, we're really just talking about another piece of the puzzle when it comes to hormones. So understanding how it interacts with estrogen, testosterone, and the body's metabolism really helps us to see the bigger picture when it comes to male breast cancer risk and why hormone balance is so important. So back to that steroidogenic pathway slide, I mentioned progesterone. So progesterone is also another hormone that we tend to think is important for women, which it is, but men make progesterone as well. So progesterone has a very calming influence. I like to think of it as kind of the calming influence to estrogen. It helps us sleep, it helps with mood, it helps with balance. Um, but when we don't have enough progesterone, tends to be the issue. So for women, it's a hormone that helps regulate our cycle, prepares the uterus for pregnancy. But the progesterone that men produce actually comes from their adrenal glands and the testes. So the adrenal glands are small glands that sit on the kidneys, and they make a number of hormones. We'll talk about cortisol in a little bit, but they also make our catecholamines, our flight or flight hormone. But when it comes to progesterone, progesterone really serves as a building block for other hormones if you think of that pathway. And it also helps the body make testosterone and cortisol. So if we don't have progesterone, we don't have that intermediate hormone to make testosterone. There's some thought that progesterone may actually enhance estrogen's effects on breast tissue, especially when hormone balance is already disrupted, like in the cases of low testosterone or high aromatase activity. And there's some thought that progesterone could act as an additional growth signal for breast cells. This is still kind of evolving on the research front. The exact role of progesterone in male breast cancer really isn't fully understood. It probably differs from its role in women. We are even looking at the role of progesterone in general in men. So we don't know a whole lot about progesterone in men as of right now. So there's actually a lot more research that needs to be done on it. But because male breast cancer is so rare, there just haven't been enough male-specific studies to give a clear answer on progesterone. But what we do know is that measuring progesterone receptor status, whether it's PR positive or PR negative, can help doctors better understand how's the tumor acting, what's its biology, how can it help guide our treatment choices. So again, progesterone is just another piece of that hormonal puzzle, and understanding how it interacts with estrogen and testosterone, super important. Okay, as far as thyroid, so thyroid makes thyroid hormone. Thyroid hormone is our metabolism hormone. So metabolism are all the enzyme reactions that help us. Also, they're hormones. They actually work at the level of the cell to influence metabolism, mitochondrial health, which are the mitochondria, the powerhouse of our cells. And really, every system of our body is influenced by the thyroid. So the thyroid itself makes two forms of thyroid hormone, T4 and T3. T4 is the main thyroid hormone, but it gets converted to T3, and T3 is the active thyroid hormone. So T3 really is what interacts with the cells. But because of all the important processes thyroid does, this is how it can influence, it influences a lot of other hormones. So when I talk to my patients about hormones, and I hope you're understanding this, not one hormone works by itself. There's no hormone in a silo. They're all working together. Thyroid just happens to be one of the ones that are most deeply interacted with other hormones. And there's a number of different ways how this works. So thyroid hormones affect how the body uses estrogen and testosterone. So they also influence how our body makes binding globulins. So there's something called SHBG, or sex hormone binding globulin. Estrogen and testosterone circulate in our body mostly bound by this protein. So if we have more or less of this protein, that means more or less estrogen or testosterone are available for use. Our body can't use hormone that's bound by protein. It has to be free to be available for use. So when there's more or less of this binding protein, it's going to affect the actual levels of estrogen and progesterone. So say like the thyroid is overactive, that actually can affect, that actually causes a higher SHBG level. The exact opposite is true for underactive thyroid. That's less SHBG. So that's going to be more free estrogen available for use, more free testosterone. So it kind of it's a little more complicated than just up and down. There's so many influencing variables, especially when it comes to the thyroid part of the picture. Also, like say thyroid is overactive or hyperthyroid, this can actually increase estrogen receptor expression on the cells. It can also increase aromatase activity. So that's going to increase testosterone conversion to estrogen. So that again, in a hyperthyroid state, how do people feel when they're hyperthyroid? They don't feel great already. They can be anxious, can't sleep, jittery, heart racing, but they're also increasing the conversion of testosterone to estrogen because of this upregulation of estrogen receptor. On the other hand, hypothyroidism or that underactive thyroid decreases SHBG, and then we have higher levels of free estrogen. So either end of the spectrum, whether it's too much or too little thyroid, can actually influence actual circulating levels of estrogen as well as testosterone. Now, what do the studies show when it comes to thyroid and breast cancer? Well, folks that have thyroid issues are more likely to have breast cancer. So particularly autoimmune thyroid disease, known as Hashimoto thyroiditis. Hashimoto thyroiditis is the most common cause of underactive thyroid. It's becoming global now. Or hyperthyroidism. There's an autoimmune state of hyperthyroidism called Graves' disease. So when we compare men with breast cancer to not having breast cancer, men with breast cancer tend to have more thyroid issues. We don't know if it's cause and effect, but we know that there's a correlation. Some scientists believe it may be that shared hormonal or autoimmune pathway, because when you're dealing with an autoimmune condition like one of these, your immune balance is off, and then it may kind of open up the door for increased risk for cancer. But it's important to note we don't know as of yet. It's just a correlation that's being evaluated. And the thyroid might just be one part, again, in this hormonal puzzle that we just need more information. But the key takeaway is, thyroid health is important, whether men or women, and it does influence other hormonal balances like estrogen and progesterone and testosterone. So I do always recommend regular thyroid monitoring, along with your just routine physical exam. Now, cortisol is our stress hormone. Cortisol is our most important hormone. We need it to live. If we don't have cortisol, it makes it tough to live because we can't mount an immune response against any stressor. I like to think cortisol gets a bad rap, though. It's kind of like it needs its own support group, because there is good stress. There's good stress and there's bad stress. So good stress helps us get through stressful environments. It's really bad stress or chronic stress that leads to problems. Cortisol, as I mentioned, is produced by the adrenal glands that sit on top of the kidneys. It helps regulate blood sugar, influences inflammation, our immune health. Our body uses energy. It's our get up and go hormone. It should be highest first thing in the morning with a gradual decline by the end of the day. It helps us handle stress, whether it's emotional stress, physical stress, illness. But the issue is when cortisol is high for long periods of time, we see imbalance and inflammation, and that's when we also see an increased risk of chronic disease. Now, we do know that high cortisol over time can lower testosterone. So think about that pathway again. If we're driving our energy towards making more cortisol, we're going to have less testosterone. It can actually increase estrogen activity by increasing aromatase activity. So if you're already having low testosterone, we're upregulating aromatase, so we're increasing estrogen. Over time, cortisol weakens our immune system, so we can't fight off. We don't have defenses to fight off. We see an increase in autoimmune issues. And it's just this increased inflammation. It not only makes us feel horrible and fatigued over time, it's kind of it's not a good scenario for our health in general. When we look at chronic stress and chronic disease, we see an increased risk for just mental illnesses, depression, anxiety. We see an increased risk for diabetes, heart disease, cancer. We see an increased risk of autoimmune issues like Hashimoto thyroiditis or Graves' disease or any of the autoimmune issues. And when we see this, we see this correlation, and when we look at studies, the way we evaluate cortisol is by, we call them cortisol curves. Cortisol should be highest first thing in the morning with a gradual decline towards the end of the day. But what happens over time is if our brain can't live at that high level, we see a down regulation or a flattening of the cortisol curve. And this is where we start to see the emergence of chronic disease. And when we look at the long-term studies, when we correlate cortisol with any of these conditions, when we look at studies of cancer, outcomes are worse. We look at studies with cardiovascular disease, outcomes are worse. Any of these chronic diseases, when we see this flat cortisol curve, it's not a good sign. So cortisol is so important player in this mix. So I mentioned other hormonal risk factors for male breast cancer, obesity being one of them. I think we kind of covered that. Liver dysfunction, again, we've covered that. Klinefelter syndrome. So Klinefelter syndrome is a genetic condition where a male is born with an extra X chromosome. So their chromosome isn't XY, it's XXY. So men with Klinefelters tend to have smaller testicles. They have lower testosterone levels and higher estrogen levels. They are actually up to 20 to 50 times more likely to develop male breast cancer because of this long-term hormonal imbalance, because they're born with it. I mean, and from day one, they have this imbalance in their hormones. So men who have testicular disease or testicular injury also have an increased risk because the testes produce most of a man's testosterone. So if there's injury, if there's infection, if there's condition like an undescended testes, we do see testosterone levels drop and an increased risk not only of testicular cancer, but also of male breast cancer. So remember, when we have less testosterone, we have more estrogen. It sets the stage. So across all of these risk factors is really a common theme. Anything that lowers testosterone, raises estrogen, it's a problem. So what about insulin resistance? So insulin resistance, we hear about a lot, especially in the context of prediabetes and type 2 diabetes. Insulin is a storage hormone and a growth hormone. It's produced by the pancreas in response to taking in a meal. What happens is usually insulin takes up sugar from our blood to use for energy. It's stored in fat cells. More fat we store, the harder that the pancreas has to work to send the signal, because the signal isn't being received by the muscles and the tissues of the body. And over time, our pancreas the poor beta cells that make insulin just can't keep up. So we see an increase in glucose. But here's the problem. It's more than just really a blood sugar issue in the conversation we're having today. It's really a hormonal issue. So higher insulin levels are a growth signal for cells, including breast cells. Remember, insulin's a growth hormone as well as a storage hormone. Insulin also reduces that binding globulin, SHBG I was talking about. So we have lower insulin levels, or higher insulin, lower SHBG. There's more free estrogen circulating. So it's kind of that scenario we're talking about with hypothyroidism. So, and when insulin resistance goes hand in hand with obesity, we already discussed that when there's increased fat, there's increased aromatase activity. So insulin resistance really kind of creates that perfect storm. So more estrogen, less testosterone, more growth signaling, all of which contribute to higher male breast cancer. So I'd like to touch on endocrine disrupting chemicals, or EDCs. EDCs are And when I talk to my patients about EDCs, I try not to make it overwhelming because we are exposed to chemicals on a regular basis. Most of them we don't even know what they are, or we don't test for them. Um, but they're in the foods we eat, our personal care products, what we clean our homes with. They're in our plastic bottles. So they're around us all the time. But the key thing is EDCs can act like estrogen in our body. So just like too much estrogen, these EDCs can stimulate breast cell growth. And long-term exposure increases estrogen levels and can reduce testosterone. So again, we not only may be making our own estrogen that's too much, we're taking in chemicals that are acting like estrogen. So again, we can only control the controllables. So doing the best we can to maybe limit our plastic exposure, opting for glass, working on daily detox, just doing the things that we can do on a regular basis to limit that exposure to endocrine disruptors. I did mention gynecomastia. So gynecomastia is commonly results from hormonal balance. It can be just a common, just normal variation. And it doesn't always have to be because of a hormonal imbalance, but it can be. But when it happens, it can cause it can be due to estrogen imbalance over testosterone. It can sometimes mask an underlying male breast cancer. That's kind of part of the problem. So it makes kind of a careful evaluation essential. So while gynecomastia itself is benign and very treatable, if need be, it's important to monitor for changes. So if that gynecomastia changes to feel a little bit more firm, a little more fixed mass, any nipple retraction or discharge, always, always, always prompts further evaluation. That doesn't mean it's a normal change in normal gynecomastia. It means it needs further evaluation. Just to touch on hormonal receptor status and male breast cancer, and I think probably Dr. Park went through this a little bit more. Approximately 90% of male breast cancer are estrogen receptor positive. That's why we use endocrine therapies like tamoxifen. Tamoxifen is a selective estrogen receptor modulator, so that's pretty common use in men. We're learning more about, as I mentioned, the androgen receptor expression, and that may be kind of an interesting idea that's opening up for certain patients with this androgen receptor expression. It might just be part of the future of precision care. And again, not to reiterate what Dr. Park said, but because most tumors are estrogen receptor positive, the main therapeutic strategy is to block that estrogen. So we just talked about how estrogen triggers breast cancer. We want to block that ongoing assault. And that's what tamoxifen does. In some cases, aromatase inhibitors like anastrozole or letrozole are used because they block that enzyme from testosterone to estrogen. Unfortunately, like with any medication, there can be side effects and challenges. Main side effect with some of these are hot flashes, sexual dysfunction, mood changes, which can make it difficult for some men to stay on therapy because it's a quality of life thing. You know, you've already had cancer and now you're taking a medicine that makes you feel really bad, and that's going to impact just adherence in general. I have women who are on tamoxifen, and they have the same complaints. It can be a do I really want to continue this therapy and feel this way, or do I want to take my chances? So that's why kind of follow up is so important because these adherent challenges are common, and some men may discontinue treatment because of these symptoms. There are maybe things that can aid in some of these concerns, but it really underscores the importance of personalized care, addressing patients' concerns ahead of time, addressing hormonal, psychological, sexual health, integrating multidisciplinary support. So kind of, I mean, we don't think about endocrinology when we're thinking about breast cancer, but it might be something to consider on a regular basis because these hormones do play a huge part, not just our estrogen and testosterone, but our other hormones that may be impacting. Hormonal surveillance and monitoring is very important, and it's important to encourage our patients to do that. regular physical exam like hormone lab monitoring, detecting recurrence, treatment effects, any secondary endocrine issues. So kind of looking at the other hormones that are playing a part in how a person feels. Because when symptoms like fatigue, mood changes, gynecomastia, sexual dysfunction, it is important to check testosterone, estradiol, and prolactin because these imbalances can influence what the disease course is and influence quality of life. And it's important for follow-up to see if any new or suspicious breast changes arise, like a lump or any sort of asymmetry. And again, an individualized follow-up plan is super important. I just want to mention the importance of inclusive care because in our trials, male breast cancer is often overlooked just because it's not as common as female breast cancer. And unfortunately, it's often diagnosed later than in women because of this low awareness. And men don't realize they can develop breast cancer. And that's why it's so valuable having this Global Alliance Summit because inclusive care means recognizing that unique biologic, hormonal, psychosocial needs of our male patients. Now, as an integrative doctor, I always talk about lifestyle and hormonal balance. Lifestyle choices influence hormonal balance. So, exercise, I know not everybody likes to exercise, but exercise is important. It's a great stress reliever. It's good for our body, it's good for our bones, it's good for our muscles, but it also helps reduce estrogen levels and improves insulin sensitivity. So, again, if we can decrease that hormonal stimulation, great. Weight management is also very important. So keeping to a healthy body weight because that excess body fat increases aromatase activity. Maintaining a healthy testosterone estrogen ratio is essential. And again, I know we can't avoid all the EDCs out there, but control the controllables, right? So try and avoid plastics, pesticides, certain personal care products that may be triggers because we don't want to have anything that mimics the effects of estrogen. Just a note about anabolic steroids. So anabolic steroids and testosterone replacement are kind of two different things. Testosterone replacement in the general population is under medical supervision. Anabolic steroid use is generally not monitored and oftentimes at very, very high testosterone levels is the result. So when you're imagine if you're giving very, very high doses of testosterone, we're going to convert more testosterone over to estrogen, and that can stimulate breast tissue proliferation. Now, when I'm monitoring my patients on testosterone replacement, I always check estradiol levels because I don't want to create an environment where I'm increasing testosterone to estradiol to a high level. Again, we don't want it to be zero as far as estradiol, but we want to try and keep it in balance. So that's why it is very important. Testosterone replacement is a great treatment, but anabolic steroids is unregulated and causes a dangerous environment. Integrative medicine, as an integrative doctor, we talk about the conventional foundations, which are nutrition and lifestyle, which is an anti-inflammatory diet. Mediterranean diet is kind of my go-to because it helps reduce oxidative stress, supports metabolic balance, regular exercise. Mind-body practice is super important as well. Mindfulness, yoga, meditation. Now, I kind of talk about this with my patients all the time, and I encourage them to do something that they like. It doesn't have to be yoga. It has to be something that they enjoy. So whether it's listening to music, going for a walk, going out on a boat, whatever it is, if it's calming, I'm all for it. There are certain studies that show a benefit of acupuncture in managing follow-up and emotional resilience, I should say. And there's tons of natural compounds we can use. Omega-3 fatty acids are anti-inflammatory. Vitamin D supports our immune system. Polyphenols, so that includes a green tea, curcumin, resveratrol, all great anti-inflammatories. Plus things like green tea or resveratrol really have some anti-aging benefits too. So there's a 2-for-1 for that. And we can't forget the importance of gut health. About 70% of our immune system lies in our gut. So we want to keep our gut in balance. So whether there are tons of, not shouldn't say tons, there are great gut testing kits out there, but I just, a probiotic and a prebiotic, if you start with that, you're halfway there. And finally, there are other male cancers influenced by hormones. That's going to be prostate cancer, testicular cancer. Again, it's kind of that same scenario, and other cancers like thyroid cancer and adrenal cancer. The key takeaways are hormonal imbalance is central to male breast cancer development. Estrogen excess, testosterone deficiency are major drivers. Receptor testing, especially in the advent of perhaps some androgen receptor therapies coming on board. Tamoxifen tends to be the mainstay of treatment, but don't count out integrative therapies. So all the things that kind of decrease inflammation. And obviously greater awareness and research are needed, which is one of the benefits. So on my last slide, I just want to introduce you to my dad, Guy. He is a awesome dad, awesome husband, obviously an Eagles fan, retired principal and a school administrator. But at 77 years old, he was diagnosed with male breast cancer. He found a lump. He went and got it evaluated, had a biopsy, had surgery, went through radiation. He was on tamoxifen. I'm happy to say that actually last week he had his follow-up with his oncologist, and they discontinued the tamoxifen because he doesn't need it anymore. I and when I first got into contact with the Male Breast Cancer Global Alliance, I asked my dad about this. And I said, Dad, what do you think about this? And he goes, I don't like to think about it because it's embarrassing. I said, Dad, how are we supposed to bring awareness if we don't talk about it? And I think for the first time ever, my dad said, you know what? You're right. So I'm happy to say he's doing well, and he's one of my heroes. And I want to thank Sherry for this opportunity to talk about this subject. I want to thank the Male Breast Cancer Global Alliance and all of you for um, uh, being interested. So that's super important, building awareness. So thank you.
Thank you, Dr. Mazza, and thank you for sharing your dad's photo at the end. I was wondering if you were going to do that.
Of course.
Thank you for introducing us to Guy, and we have put Guy's story up on our website, so he is one of the contributors who's come around to tell us his story. So he's helping others understand this disease, and we thank him for that.
Oh, well, thank
I
you.
I do have some questions for you, though,
Yeah,
that
and I
I was
apologize for
here.
running a little over.
Oh, don't worry about it. We told you we saved the best for last. I'm just going to advance my slide
Okay,
and give
I'm
you
gonna stop sharing.
a few of your questions here. Let me see. What do you wish younger men, sons, brothers, and husbands, knew about hormones early in life that could help them prevent disease later on? And I know this also goes to a lot of the younger men. I used to be a gym rat myself, so I would see a lot of these younger guys, and they would be bulking up, and then next time you see them, they'd be real skinny. And I always worried about all of the stuff that they were taking, and how does that all play a part, and can that cause cancers?
Oh, that is a great question. And I've been doing endocrinology long enough where I've seen all sorts of different things that I hate to say guys are doing in the gym, because I'm sure there's women doing things too, but all sorts of different concoctions that people are using. I would say, we're in that setting, you know, too much isn't a good thing. Um, our body, and I hate to keep saying the same thing, our body wants to be in balance. If we push it too far, it leads to an inflammatory state. So if we're kind of overdosing on the steroids, too much, too much, too much, that pathway it's all about pathways. If we saturate the one pathway, it's not going to stay as testosterone. it's going to start being converted to estrogen. And estrogen, even in a female setting, too much estrogen is inflammatory. And unfortunately, that sets the stage for not only not feeling great down the line, it sets the stage for different imbalances, including cancer. And unfortunately, I've seen a number of guys over time, because of different things they've done, they've really messed up their internal feedback loops. The pituitaries are just not working and not listening to signals like they should anymore. So our body can only handle so much overdrive for so long, and it's just gonna become dysfunctional.
And it's going to push back.
Yeah,
Yeah,
unfortunately. We're designed a certain way for a reason.
I know. I know. Men are often reluctant to talk about hormonal health. Why is it so important for men to take hormones seriously, not just for energy or libido, but for long-term cancer prevention and wellness?
I love this question because we kind of have gotten into this discussion of as far as like anti-aging, longevity, and resilience, but hormones play a huge part in that. So we have studies now that show that t just testosterone, for example, it actually has positive benefits on insulin resistance, cardiovascular disease, where we thought, oh, in the past, that's bad. Same thing with hormone replacement for women. So the pendulum's really swung. We still need larger scale studies to really improve our knowledge base. But why do men not want to talk about it? I think it's just hard for some people sometimes to talk about it, and they feel like that reflects on them as a person. They're failing somehow,
Like
but
a weakness.
yeah, like a weakness. But it's really not that. I kind of look at hormone replacement therapy if need be. And there's ways to increase your own hormone production too, I should add. Um, but it's really just bringing your body back into balance. And you don't know unless you test. You can suspect it, but testing is black and white, and it helps you and your doctor come up with a plan forward that's right for you. So.
Okay. And that comes to the next question. Men often delay medical care. When should a man ask his doctor about hormone testing, and what simple tests can start the conversation?
Okay, great question. I mean, I honestly start the conversation as early as possible. I would say when you're in your 30s and 40s is probably the best time, because your 30s and 40s set the stage for your 60s, 70s, and 80s. So, I mean, if you want to just get basic testing, um, getting a blood glucose, fasting glucose level, fasting insulin level, um, if your doctor's open to checking, getting a baseline testosterone. I don't do total testosterone levels just for that reason of the sex hormone binding globulin. I usually order
Hmm.
free testosterone and bioavailable. Um, Again, with all my male patients, I do check estradiol levels. I do check progesterone levels. That's kind of something that's been coming into, we found an importance of progesterone in men too, because you can replace hormones like testosterone, and you can address the estrogen, but if progesterone's still low, we can have some still mood imbalance. So if you even start with that, and thyroid, you can't ignore thyroid. Thyroid is essential, just as TSH, free T4, free T3. And but depending upon your doctor, I mean, I do also recommend cortisol testing to see where you're at as far as your cortisol.
Okay. I have one last one for you. Hormonal imbalance can be silent. What symptoms should men pay attention to that might signal a hormonal issue worth checking before it contributes to a bigger health problem?
That's a great question because everybody's different.
Bit
That's the
different.
beauty of medicine. If you feel like your motivation and stamina, and for guys, that tends to be a big thing. If they feel like they're just not feeling as motivated as they used to, fatigue is kicking in earlier than it used to, exercise tolerance is dropping down. Libido's a big one. I mean, if you notice a change in your libido, you really should get checked out. I mean, women were a little bit more forthcoming as far as, you know, um, changes in skin and hair and and hot flashes and night sweats. We're and weight changes. We're a little bit more different in that regard. But I would say if a as a guy, if you're noticing changes in your fatigue, in your energy level, motivation status, and exercise tolerance and libido, it should get checked out.
Okay. And I do have another one that came in for you, so you're not getting off here yet. For a newly diagnosed male, during the course of treatment, should the male hormones levels be checked and monitored before endocrine therapy and or after? If so, who, oncologist, endocrinologist, or PCP should be doing those
Mm.
tests?
That's a great question because I always am a fan of checking hormone levels before and after because then you know change over time. Um, who should do that? I guess it depends upon your oncologist. If your oncologist feels comfortable doing that, great. If your primary care doctor feels comfortable, every doctor's level of comfort is going to be a little bit different. If you do have an endocrinologist, that's great because the endocrinologist will probably be able to do that for you. Or if you want to consult an endocrinologist, say, "Hey, this is kind of what I'm dealing with. I just want to really know where I'm at with my hormones before, after, during, and just there's no harm in doing that as well."
And just a question for anybody who's on any of our survivors. If for some reason they do get a test done, um, would we be able to connect you with them so that you could help explain it a little bit better to them? Is that something that you would be willing
Well,
to do, or how does
well,
that all work?
I can always connect them with someone close to their area,
Okay.
no problem.
Okay. Perfect. I don't see anything else coming into me. Well, I thank you very much, Dr. Mazza, for your time.
Oh, thank you, Sherry, and thank you for all your hard work. It's so very much needed and appreciated.
Thank you. And that brings us to the end of our presentation for today. I hope you have enjoyed the past 2 days and you've taken away some interesting information. We want to again thank our sponsors because without them we wouldn't have been here. Lilly, Pfizer, Daiichi Sankyo, and Novartis. And also to let you know, I don't know why I have a hard time doing this today. There we go. We do have one additional webinar this year coming up on November 18th. It is at 11 a.m. Eastern Standard Time. Dr. Barbara Bartlick will be presenting Coping with Cancer-Related Distress and Anxiety. So if you hopefully can join us, have your questions ready. If for some reason you cannot, please feel free to email me them. I will